I'm Dr. John Stracks, a physician who focuses on the reduction and elimination of physical symptoms using mind-body medicine methods. I'm here today with Dr. Yana Dubinsky, who's a psychologist who works with us at Cormendi Health. Dr. Dubinsky works with clients on a variety of issues, but her specialty is exploring relationship dynamics so that her clients can get clarity and find healing in their own relationships. She finds it extremely effective to use a relational approach, whether working with couples or individuals. That's what we're going to talk about today. A note before we get started, if you'd like to learn more about working either with me or Dr. Dubinsky, you can visit our website at cormendihealth.com. Yana, thank you so much for being here with me today.
Yeah, thanks for having me, John.
And so you also are extraordinarily interested in relationships and you do a fair amount of couples work. So is that something that you had always been interested even when you started training, or is that something that you grew more interested in as you started to practice?
I've always been interested in dyads. I've been interested in relationships, how people appear one way in the context of one relationship and another. I've been curious about that. And I like kids. I've always liked working with kids. I worked as a camp counselor growing up. And I knew I didn't want to work with kids, though. That was something that I knew I wanted to work with adults. And I figured that could be a way that I could help the kids. If I could work with their parents, if I could work with the parents, helping the parents feel better. I've always had this idea that kids will be happy if mom and dad are happy. If mom and dad are happy and getting along and able to communicate and model how to navigate conflict, and they can model what forgiveness looks like, what, coming back together after a fight looks like, kids will be okay. So that was my interest in starting to work with couples, is trying to figure out how I can help the kids who I knew I didn't want to work with. I like kids, just didn't want to work with them.
And how much of your practice now is couples counseling?
It varies. I would say maybe a third, sometimes up to a half.
Yeah. And in the mind-body medicine world, there's a lot of attention paid to individual characteristics. And so people who are listening frequently have identified perfectionism or self-criticism or people-pleasing as reasons that they have chronic physical symptoms. I think there's a lot less attention paid to the effect of relationships on our physical body. And so as you've been doing this work for a long time, and you've been here for the past year, how do you think what happens in our relationships influences our physical symptoms?
Relationships bring stuff up, whether we're talking about family relationships or friendships or relationships or significant others. I'll focus here on romantic relationships. Sometimes feeling disconnected can just creep into your relationship, and it could feel like something is missing. And feeling disconnected can make it hard to then engage with one another, furthering feelings of loneliness, furthering the disconnection. And feeling disconnected may be on your mind, and it could create worry and stress and other concerns. And when we feel stress, tension, anxiety, it can manifest in physical symptoms. And so that has been such an honor for me to be invited into families, be invited into relationships to help kind of take a flashlight and take a look at what may be going on there and helping name what it may be that is going on.
And, one of the things that we think about individually in terms of symptoms is this tendency to keep our emotions inside. Do you think that gets amplified in relationships, where if you're keeping thoughts or feelings or experiences to yourself, they can then start to show up in physical ways?
Yeah, absolutely. Because when we have a feeling or a thought or an idea, and then we don't name it, we don't label it, we don't share it, we keep it in, we sort of can develop a bias. Oh, here he goes again, or here she does this thing again, or he's working late again. And this bias that may have started with a feeling can grow. And we know from confirmation bias that when we have an idea about something, sometimes we just only can see, and it strengthens our bias. And so naming it, in a way, it kind of like diffuses it. It invites somebody else in to how it feels for me when you work late, for example. And we'll talk a little bit later today on some ideas about how to share some of those feelings if it's never come up, or how to do it more effectively if it keeps coming up and doesn't feel productive.
Yeah. And so say you're working with somebody in individual therapy and you find out that there's a relationship issue that's causing either life stresses or physical stressors for them. Even if that other person, the other half of the couple isn't in the room, how would you work with that individual to try to strengthen that communication in the relationship?
First, we create space. The therapeutic relationship is a really unique relationship with boundaries. There are professional boundaries, and having those boundaries allows people to talk about things in a way that it's just about them. Because as the therapist, all I know is that individual's perspective, and that perspective is valid and it matters. And so, in creating a space, a safe space, to explore some of those feelings, patients are able to name them better. They're able to identify their triggers. They're able to notice how their physical body may react to something that we may not think about. Sometimes when patients come in and they say, "Oh, I was so mad when, she did this." And then my offer to, "And what did it feel like in your body?" I
Mhm.
often get people like, "Oh, I was just so mad I didn't even think about it. What did it feel like in your body?" "Oh, yeah, I guess my hands were really clenched." And so then we can talk a little bit about, so what was your body telling you? In this example, they knew they were angry, but sometimes they may find their fists clenched and they don't know what it is. So that could be a way that we could talk it through. And I often think that and share with patients that we don't have remote controls for other people. So of
What if we
course,
want remote controls for other people, though?
of course we want them. We want to make people get it from our perspective, or to do it differently, or to do it better. And individual therapy can offer clarity about what is ours and what isn't ours. And once we have that really clear line, oh, this is where I end, this is where my partner begins. Oh, there's a lot I can do on my part, which influences the whole relationship.
Mm-hmm.
So that's something that we work on.
Right, because I see a lot of people who say, like, look, I don't have the problem. They have the problem. If they were more present or kinder or more patient. And so, how do you work with that if somebody says, like, look, I'm doing my part, but they're not?
And so, if it's just an individual person, we really clarify what is that boundary. And usually, what happens is the way that they have been communicating the way that they feel when that person is being unkind or gone a lot is there's a lot of accusations, there's a lot of blame, a lot of you do this and you do that. And there's two perspectives. And even if your perspective is objectively correct, you still need to have a way to express that and articulate that to someone else, again, because we don't have the remote control, which would be so handy.
It would. And do you think that you've seen people who have seen improvement in their relationships based on things that they're doing individually with you?
Yeah, absolutely. I mean, relationships are a dance, and that is not my word. The Dance of Anger is Harriet Lerner's book, which, as you know, it's my favorite book to recommend. And it's my favorite book to recommend because it takes some very basic concepts, but she describes them beautifully. And so her use of the word relationship as a dance, it made sense to me immediately because, well, of course, if I'm dancing with someone and we're used to dancing the same way, and I don't like this dance anymore, well, I'm just going to change the way I dance. Well, first of all, they're not going to like it right away. But sometimes it's because it's, what are you doing? Change back, go dance the way that we used to dance. And so being able to do your part of the dance and understanding, oh, but I am going to impact change. I'm dancing differently, which is going to impact the dance, is how I've seen it. It's having, again, that clarity and how I can explain and express and let you in and what it's like for me when you are yelling at the kids or when you are working so much, versus convincing you just need to change or do better.
Right. One of my favorite relationship stories, I was working with a patient and he had bought a Tesla and was super excited about it, but then realized like it just didn't work for him because he had to drive all over the Chicago area and he kept running out of battery on the highway. It would take like 9 hours to recharge the battery. So he went to his wife and said, "Hey, honey, I've got a great idea. You take the Tesla and I'll take your car." And she was like, "No, I like my car." And so I said to him, he was super frustrated. And I said, "Well, how'd you feel?" And he said, "I felt like she was making a mistake." And I said, "Great, let's take a look at this. I've got a wheel here with lots of feeling words. Let's see if we can find you're making a mistake in the feelings." And so oftentimes, right, we have our wishes and our thoughts, and then we just project that out onto the other person. When I helped him identify, like, he was kind of frustrated, a little bit embarrassed about having bought this car and uncertain about what to do next, when he went back to his wife and said that, it totally diffused the situation and they were able to work it out. But as long as he kept thinking like, oh, it's her fault, then there's nowhere to go with that.
He was wanting to convince her to see it his way because it made sense to him. And he may have been sort of correct if there was some objective measure of who's right and who's wrong, which there isn't. But that didn't matter. She was the one he was trying to talk with. So he needed to figure out, well, how do the two of us communicate in a way that you can understand what the meaning of it is for me?
Yeah. Yeah. And so you also do a fair amount of couples work. And so how does that change the dynamic if both halves of the couple are in your office or in your Zoom room talking with you?
I find it to be really efficient. I find that couples, both halves of the couple, feel heard. As a couples therapist, it's different than doing two individual therapy sessions. A couples session is about my patient is their relationship. So neither of them are my patient. Their relationship is my patient, and so through that lens, both people feel like it's not about convincing Yana who's right or who's wrong. It's about helping Yana's patient, our relationship, be seen. And then what do different halves need? So I think couples therapy is really efficient. And for me, instead of somebody telling me what happened, I can see it happening. And so we're able to sort of hit pause in a way and able to say, this is what I'm hearing. Here's a little part. Let's try that again, but with this. And then for them to see it. So instead of me telling them, hey, do this and this and this, and then it will feel different, they get to experientially practice.
Mm-hmm. And so, so if people are watching and they've never been to couples therapy and sort of don't have a good sense of what it looks like, and so both people maybe are sitting there, say you're doing it live and not on Zoom or even on Zoom. And so one person says, they need to do more like this, and then the other person says, well, I already do it like that. Like, how do you work with that? How do you work if both halves just aren't seeing things the same way? What helps them?
What helps is a way that you share the way you see it. So you're exactly right. That is usually how it comes up. Well, she does this and I do that. And then she. And so sometimes I'm even using my finger because that is what people will do. And so we review some ground rules where we talk about using the word you and we talk about how it feels. And both people feel it immediately. Everybody, they get it immediately. When somebody's telling you that you did this, it doesn't help you stay open and hear it. You want to get defended. It's just like if I came to you with my finger, you want to push my finger away. That's how it feels when somebody's using the word you. And so I offer some guidelines, and it's hard, of course, when emotions get heated, things come up, and they do just want to let me know, yes, but he did do this thing. And so I offer them an opportunity to say it differently, but talk about what it felt like for you, whether we use the feelings wheel that you reference, which is such a handy tool. There's this STEM sentence that I offer people. So talking about, I feel blank, name the feeling. When you blank, describe the behavior, because, and offer a little meaning for you. 3 sentences. 3 sentence chunks are one of my favorite strategies. What usually happens is if I just want to tell you how upset I am, I'm going to tell you, and I may talk for a good 3, 4, 5 minutes. That's a lot of information for you to receive, integrate, understand. And then I stop, and then I look at you. Well, you don't say anything back because I just talked at you for 5 full minutes. Well, I have a lot of reactions, but I don't know which one. But if I just said 3 sentences, I feel sad when you work late most nights of the week because it feels really lonely.
Mm-hmm.
Then I stop.
Mm-hmm.
You really have a chance to engage with me, and then I feel heard.
Mm-hmm. And do people get the opportunity to practice that in your office with each other?
They do. And one thing that I notice is it immediately slows things down. Because
Mm-hmm.
if I just want to tell you how wrong you are and how unkind you are, I'm going to go quickly. I'm going to escalate. I hear people's voices, their rate of speech go up. When I tell them, okay, try it with 3 sentences, what I notice immediately is voice gets deeper.
Mm-hmm.
They
Mm-hmm.
start talking slower because now they're thinking, okay, well, if I have 3 sentences, what do I want to say? And when your voice gets deeper and you talk slower, your physical body, your heart rate slows down. All of these other physical markers are also working. Your nervous system gets more relaxed. And when we are not in fight or flight, then we could hear better. Our frontal lobe can then be open versus if we're in fight or flight and if we're feeling really activated, I'm not able to really hear what you're saying.
And going back to where we started the conversation, if we're in fight or flight all the time, then we're more likely to feel tense, start to have physical symptoms, get headaches, aches in our back, everything else. And so as our nervous system calms down in the relationship, that's one of the ways I think that the physical symptoms calm down too. Um,
Yes.
can we do a quick role play and show
Sure.
people what it's like?
Sure.
Okay.
What's our topic?
Driving.
Sure, that's a good one.
So all right, so I'll be the driver, you be in the passenger
Okay.
seat. People listening may have some experience with this.
Okay.
And so maybe we'll role play like what it usually looks like and then how potentially it can be diffused.
Sure.
All right, so I'm driving.
And you just did a crazy turn thing.
I'm not.
Yes, you did.
No, I didn't. I pulled up to
I
the stoplight and
always do this.
I
You
no,
always do this.
I don't always. What do you? No, I don't. I was perfectly safe.
You always do this. You are super unsafe. We have kids in the car. You probably didn't even see that pedestrian.
Fine, fine,
You
fine. If
are
you
a
want to
terrible
drive,
driver.
I'll just get out and you can drive. That's fine.
Great. So now kids are activated because now mom and dad are yelling at each other. We're assuming this is a mom and dad situation, but they're tense. Wherever, what if they were going to like a wonderful park date or something? It's sort of everything gets crumbly.
Yeah. And so, all right, so can we figure out how potentially we could do it better?
Yes.
Okay. All right. So here I am driving along.
And you did the same
Same
unsafe
turn.
turn thing. Oh my gosh. I'm having such a hard time right now. I'm feeling so unsafe. I'm feeling so unsafe right now.
We're
Uh,
why are you feeling unsafe?
John, I just saw that pedestrian that I don't think you saw, and I'm feeling so scared when you drive like that, when you're on your phone, because I worry you'll make a really serious mistake that'll really cost us and our family. My heart is beating so fast right now. This is so not good.
I am a safe driver and I hear that you feel unsafe and I don't want you to have to feel that way.
Yeah, like I'm feeling so sad right now. Like we're driving to this forest preserve and I'm like all like shaky and nervous because this could have ended so badly for us. We could have been going to the police station or God, the hospital, worse. I'm just feeling really nervous and I want to ask if I can drive. I think it'll help me focus so we can get to the park thing and have a nice afternoon.
That actually might even be helpful because I've got these texts that are coming in from work. And so why don't you drive and I'll finish up the work before we get there.
So what I think is great about this role play is, yeah, we ended in the same spot. Sure, I get to drive. Um, but I think what I noticed is both of us, first of all, we're talking slower. And I was just talking about me. I was just in none of, I didn't tell you that you are an unsafe driver. I didn't use any absolutes. You always do this, like I did the first time. I was able to keep myself calm because I was telling you what my experience was. Now, some of our viewers may be thinking, oh my God, that would never happen in our car. And I'm here to say it can.
Hmm.
It can.
And how quickly, and so that was my thought too, right? That, I mean, this is a role play and you and I do this professionally, and and you and I also have our own relationships too, and so I've had practice with all of that. But can couples really change from that one to the other, and how quickly can they do that?
So it could happen in individual or in couples therapy. You asked me earlier, if you're working with an individual who's married to an erratic driver, what is that person to do? They can't make them be a safer, better driver. But with that individual, let's just say in this scenario that the role play that I was doing was the one in individual therapy, then we could work of how she contributes to the situation. It was an unsafe situation, and how I contribute could either escalate it up. Now, kids are screaming because they want to distract parents from fighting with each other. So they start making noise so they could diffuse it, which escalates the whole car. I didn't really help you become a better driver just by pointing out that you always do this. So by working with even just the one person, we can make a change in this dynamic. Reverse it. Let's say that you are my individual patient.
Yeah.
You say to me, my wife is such a backseat driver. I'm a super safe driver. Whenever we get in the car, she's always telling me the kids are in the back seat. Look at this. Watch out for this. You're always doing that. And I can't, I know what I'm doing. I know they're my kids too. I know I'm being safe. How can I make her stop?
Mm-hmm.
The same way, if you're driving and somebody points something out to you, you have a way to respond here. You can either get defensive. No, I don't. I'm a safe driver.
Mm-hmm.
Or
Yeah.
you could hear it a little bit differently.
Right. I'm hearing you feel unsafe or owning my own feelings. Like, I feel really hurt and blamed when you say that I'm doing my best.
Yes. And either of those situations, trying to keep your voice down, or maybe we do need to pull over because sometimes in the heat of the moment, sometimes we cannot access. Well, what was that thing with I feel what? I can't think of it. So just if my heart is beating fast because I'm getting yelled at or I am yelling, I'm not able to think clearly. So maybe we do need to pull over and I don't know, take a couple deep breaths. Or maybe when I'm driving, I can just focus on soothing my nervous system so that I can contribute to the interaction a little bit better.
And one more time, what did you say in that second role play? Like, how did you take responsibility for your own feelings there? Just sort of trying to think of the stem. I feel, what is it? I feel.
When you
Hmm.
and which is a description of a behavior. So I am feeling scared
Hmm.
when you drive fast or when you drive while checking the phone because, and then I offer a sense of meaning because that in and of itself may not be obvious to you. So then I want to offer because it makes me feel unsafe because of the kids.
Hmm. Hmm.
So I took the focus from you to me.
Right. And it's much easier for me in that role play to respond with compassion than with aggression of like, you're such an unsafe driver. Like you said, like as soon as people start pointing, then we want to defend. But if
Yeah.
I hear you say you feel scared, then I want to enter into that conversation.
Mm-hmm.
And so
You're
part of
more
what,
likely, maybe we could say like you're more likely to enter into the conversation because you're hearing it differently versus just needing to defend yourself.
yeah. And so what you're saying and what we've been talking about is that no matter what the relationship, like we all have our own part to play in this, and how we communicate can affect the overall dynamic, no matter who the other person. Yeah.
That's right. That's exactly right.
Are there other communication strategies that you think are useful for couples? I think that's a big one. Are there more?
Yes, there are three that I want to spend a little bit of time talking about, because if anybody, who's watching this is thinking, okay, so after watching this, what's one thing I could take away and improve my relationship today? So I'll offer three and then pick one. Pick one and try it today. So one is talking at our partners, not with our partners. So, I see people want to get all the things that have been, done to them. They want to get it all off their chest. My husband calls it like the airing of the grievances. It feels so good, but it's so not helpful. And so talking at someone can actually elicit a flooding response. So flooding is a response that some people get when they just get overwhelmed. Like little babies who are overstimulated, the only thing they can do is just like turn their head away. That's their way to control the stimulation coming at. As adults, we still can have those markers. Like I was saying earlier, heart rate can go up. I could start to sweat. I could start to feel tense. And then I'm not able to focus. I'm not able to really hear. I get flooded. Sometimes people will like turn their chair away slowly, but I will see that if somebody's really coming at someone versus talking with them, I'll see somebody like put their head down. That is their body's way of shutting down. I'm feeling flooded.
Mhm.
And so helping people, first of all, understand that it's not that your partner doesn't care about you or doesn't want to listen. Their bodies are reaching a threshold, and people have different thresholds.
Mhm.
I
Mhm.
can talk about feelings all day long. Somebody else might not. And so if I'm with someone who has a different threshold, I need to be mindful of what maybe my intensity can do to them. So how do we not talk at somebody, but how do we talk with? So 3 sentence chunks, like we
Mhm.
were saying earlier, is a great way to slow yourself down and be more thoughtful about what you're wanting to express.
Mhm.
Talking about yourself and avoiding the use of the word you,
Mhm.
avoiding absolutes. Saying something like, you always do this,
Mhm. Mhm.
is going to give you a response of, no, I don't.
Right.
Because none of us always do anything.
Yeah.
Even saying something like often or a lot of the time is still so much better. So avoid talking at someone by not using absolutes, focusing on yourself, sharing your feelings, and using 3 sentence chunks.
And the 3 sentence chunks, is that exactly the same as what you were saying earlier? I feel blank when you blank, and so blank. Is that what you mean by the 3 sentence chunk?
It doesn't have to be.
Okay.
It can. If you know the feeling you want to share, I think using that stem can help organize your thoughts for you. You don't have to. If you just want to tell somebody something, even just saying it in 3 sentences and then stopping yourself, letting
Mhm.
them respond, and then saying more is
Mhm.
already going to make a really, really big difference.
Mhm. We in our house, both with my partner and our kids, we have actually like taken out talking sticks, or sometimes we just use like a kitchen spatula, but some signal that one person is able to do the talking in the small sentences, 1 or 2 or 3 sentences at a time, and then we have to pass the talking stick to the other person. And it's actually like our kids have learned it and done it at times when they've been fighting, and it's I've found it really helpful to make that clear, like whose job it is to talk, whose job it is to listen, and then do it in those small segments so that nobody gets flooded and overwhelmed.
And it's such a helpful tool, and one that I think is really hard. It's amazing that you guys have been able to implement that in your house, and I bet it was really hard at first.
Yeah, yeah, for sure, for sure.
People want to prepare their rebuttal.
Mhm. Yeah, yeah, yeah,
I'm not listening. I can't wait till you're done. I'm going to tell you exact.
yeah, yeah.
Then I'm not listening.
Yeah, yeah. And I think, yeah, and I think that's why that technique helps. It keeps people from talking over each other, and makes people tune in to what the other person is saying.
Yeah, yeah, it helps us listen, because when we're not listening, we're not able to really understand what it is that you're sharing. And so all of these things that we're talking about, how to talk about yourself and sharing your feelings, if your partner is just preparing their rebuttal, that's where couples therapy can come in. We're giving the directive to two people. They could both be accountable for it.
Yeah. Other communication strategies
Yeah,
that are helpful?
yeah, so starting harsh. If we start soft, we have a better shot at keeping the conversation soft and more open. Starting harsh could mean like starting with an accusation or starting with blame. Starting with the feeling helps us prevent flooding our partner and helps us stay focused on what it is that we're trying to say. And then the third one, we've talked already a lot about starting soft. So I'll talk about the third one, which is when we escalate too quickly. And this is something that I see often. And that's why I picked it as my third one to talk about today, because often the conversation starts somewhere about something really small that doesn't feel really relevant. But what happens is it quickly escalates to somewhere totally different. So now we've covered 10 different topics that I'm using to just prove my point why you needed to, I don't know, take the dishes out of the dishwasher. But now we're talking about in-laws and vacation from 10 years ago. It is really hard to track. So to prevent that escalation, fight what you're fighting about. Anything else that comes up, it's important. It deserves its own time. Find another time to talk about that. Don't try to mix it all in. It's hard to keep track. And how do we do that is by slowing down. So I often say, like, don't hijack conversations. And that's another way that you could do it, even if you're individual therapy, resisting the urge. Really working on yourself to resist the urge to bring in that example, even if it illustrates your point beautifully. Find another time, fight what you're fighting about.
And so, and it's hard, right? Because in the heat of the moment, like it all comes so quickly. And so deep breathing, staying calm, practicing, all that helps us recognize like when we're getting further afield from what we were initially arguing about.
Yeah.
One of the most common questions I get asked about all this, and we've covered this somewhat, but people say, you know, I'm perfectly happy to work on the relationship. I'm perfectly happy to do to change things, but my partner has no interest in this. And any additional thoughts for people who feel like the relationship needs to move in one direction or another, but their partner is either totally satisfied with the way things are or appears to have no interest in changing any of this? Any thoughts about what people might be able to do?
I think it's important to understand the difference between not having interest in versus being afraid. When somebody doesn't want to go to therapy to work in the relationship, a lot of the time there may be something they're afraid to discover. Sometimes if, you know, if one person, well, usually one person makes the appointment and they both show up in my office, I'll ask each of them, why are you here? And sometimes I'll get, well, because he made me, or she gave me an ultimatum. And so we work with that. And if that person, let's say, weren't successful getting their partner in, and I'm just working with them alone, I think it's important to find compassion in other people and what may be going on, that what has happened in your conflict in the past that might make them not be open to coming to therapy. And then let's just work individually to see what you can impact. Again, to being mindful of what part can you contribute? Where do you end? And where does your partner begin? And can you find some satisfaction in the relationship by showing up differently?
Yeah, it's like when people ask me and they say they're working on physical symptoms and they don't know if it's physical or psychological and they have an injury and how can mind body techniques help? And my answer is frequently like, you know, we don't know how much can change, but say some can. Start working in this direction, start using these mind body strategies, and you may find that things get a lot better than you would have imagined. And so you're saying the same thing here, that even when it feels hopeless, there's always things that we can do to change our style of communication, how we interact in the relationship. And we don't know how much that can shift things, but frequently things that we do ourselves can shift the dynamic in the relationship more than we would imagine.
Even something small, even if you come home today and do one thing differently by just making yourself talk in 3 sentences at a time and stopping, you will feel there's going to be a difference. My guess is you'll have someone listening to you because it just feels different.
Yeah. Yeah. Anything else? Anything else you want to say to people who are listening and thinking about sort of these topics, relationships, and how it impacts their own health?
When it comes to relationships, they're everywhere, at work, with our families, with our friends. And so, even though today we've been focusing on romantic relationships, um, some of those same skills can apply to building a stronger social connection. I know we've been talking a lot about pandemic and how it's impacted social anxiety and how people are feeling disconnected from other people. And that also will have physical manifestations because it brings up worries, concerns, stresses. And connecting with someone by being open, it creates kind of like this attraction to want to spend time together. And so I guess also what I wanted to say is talking about yourself, sharing feelings, being as authentic as you can be and showing up who you are will also help in situations that may feel socially anxiety provoking.
Yeah, yeah. Thank you. We're going to end our conversation there for today. Thanks so much for being here and sharing your experiences and your insight and your wisdom. I know how much people appreciate my patients, both here and over the years, have appreciated getting to work with you and your kindness and insight uh, and and excellence. And so I'm thrilled that you can both be here in our practice and here today sharing some of what you have learned.
Well, thank you for having me here. Kermendi has been a wonderful place, both to share some of this for patients and for patients to come in and feel better.
Good. And if anybody out there is interested in working with Dr. Dubinsky or with me, you can contact our staff at cormendihealth.com. We'll get back to you with all the details that you need to know. And thank you to everybody who is here listening. Every time we record another webinar, I'm reminded each and every time how lucky and blessed I am to be part of this community of people working on healing in brave and creative and cutting edge ways. And so with that, we will end, and everybody take care.
Bye.